Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, and best wishes to all of us. Today, we're going to talk about dog bites on children, starting SGDB1. Next slide.
Thank you for the opportunity. Let me introduce myself first. My name is Krisnaditya Dwi Raharja with three last digit of student ID number 014. Now I will explain about the background of our student projects about dog bites on children. As we know, dog bites are a significant problem which cause tens of millions of injuries annually. Low and middle income countries have higher mortality rates due to prevalence of rabies and tetanus. The symptoms of rabies include change in sensory perception, fever, anxiety, hydrophobia, and convulsions. On the other hand, tetanus is an acute and potentially fatal disease that causes convulsive spasm and generalized rigidity of skeletal muscles. Children are at a higher risk of dog bite injuries to the head and neck, leading to higher severity of injuries, need for medical treatment, and elevated rates of mortality. This is a worrying trend that needs to be addressed. As the ownership of dogs continues to increase globally, there is critical need to monitor the epidemiology of dog injuries and its implication for public health, particularly for children. It is important to raise awareness about the dangers of dog bites and to encourage responsible to pet owners. Thank you, and next slide.
Thank you for the opportunity. My name is Refferty, and the last three digits of my student ID, 003. Now, I'm going to talk about problem formulation, objectives, and benefits of this student project. First, the problem formulation. What are dog bites and its implication on children? Second, what is the explanation of bite wounds and infections from dog bites that can lead to pediatric dog bites injury? Third, why do dog bites on children differ from dog bites on adults? Fourth, what is the pathology of rabies and tetanus from dog bites? Next slide. Objectives. General objectives to have better understanding about dog bites on children, including about pediatrics, dog bite injury, and pathology of rabies and tetanus. Next slide. Benefits. For readers, it is expected that they have a better understanding of dog bites, including pediatric dog bites injury and pathology of rabies and tetanus, so that they can manage the given information to bring good outcome to those around them. For other authors, it is hoped that they can use this student project as an in-depth reference for future studies about matters regarding dog bites on children, including pediatric dog bites injury and pathology of rabies and tetanus. That's all from me. Next slide.
Hello, my name is Lichana Kusuma with the last digits of student ID is 025. Dog bites. Definition. Dog bites are a common public health issue and pose a serious health risk to our communities and society. A study conducted by Guy et al. Defined bite as the lower or upper teeth making physical contact with the victim's skin with adequate pressure to cause a visible injury such as an indentation, scrape, puncture, bruise, welt, or rip in the skin. When a dog mouths someone's skin without exerting sudden pressure, it doesn't qualify as a bite. Dog bites on children. Dog bites can be a significant source of morbidity for children, given that they may leave scarring or other disabilities at a young age, including acute emotional distress. Most studies indicate that males are twice as likely as females to sustain a dog bite injury, with the 5 to 9-year-old age group having the highest incidence for both gender. Preschool children are more susceptible to sustain bite injuries to the head and face. Injury to the extremities becomes more frequent as a child gets older. Thank you, and next slide.
Thank you for the opportunity. My name is Sienny Kuswardi and the last three digits of my student number is 004. I'm now going to talk about common dog bite injuries in children. Based on a 5-year nationwide study in the US, the most common location on the body was the head, followed by the upper extremities. Children under the age of 5 are more likely to be bitten on the head, neck, or facial areas. And as children grow older, they tend to be bitten on the extremities. The type of dog bite injuries may include abrasion, lacerations, punctures, infections, avulsion, crushing injuries, and nerve damage. That's all from me. Thank you. Next slide.
Thank you for the time. First of all, let me introduce myself. My name is Rahcetag with the last digit of my student ID 030. So now I'm going to explain a bit about the bite wound. So the wound from the dog bite may consist of various bacteria. And based on the Busame experiment, he did a bacterial culture analysis. He found that 67% of the 104 dog bite wound got filled by the aerobic and anaerobic bacteria. Only 16% had an absence of bacterial growth. There will be a substantial likelihood of local infections and also 1 non-million if the injury is not promptly attended to. And not just for the local infections and 1 non-million potential, the unprompted treatment will cause the serious complications such as systemic infections and also sepsis. Therefore, the right anti-inflammatory treatment based on the specific condition of the lung is needed. Thank you so much. Next slide.
Thank you for the opportunity, but first let me introduce myself. My name is Ananda with three last digits of my student ID number is 015. Infection. When a microbe harms a person after entering their body, an infection happens. Infection, particularly after deep or severe wounds, is a serious potential complication following a dog bite. Dog bites can result in tetanus, a bacterial infection that causes painful muscle constriction, and in some cases, difficulties of breathing, as well as rabies, a viral infection that causes confusion and agitation and is almost always fatal if not treated. Next slide, please. The difference between dog bites on children and adults. Injuries resulting from a dog bite can range from minor to severe. In some severe cases, they can lead to limb and life-threatening injuries. However, most of dog bites fall in the minor category, and rather than its severity, injuries between age groups differ significantly by body regions. Face and neck injuries are more frequently encountered with children, especially infants and toddlers, owing to the fact that they engage with their hands and interact at an eye level with a dog. In contrast, bite wounds to the hand are more common in adults, as they naturally tend to use their hand as a defense mechanism during an attack.
Hello, my name is Putu Ananta with the last student ID number is 021. Now I'll explain to you about pathology of rabies and tetanus. The first one is the etiology. So rabies is a viral disease caused by the rabies virus, which is transmitted through the saliva of infected animals, usually through bites or scratches. The virus can be also transmitted to contact with mucous membrane and open wounds. When the virus enters the body, it causes inflammation of brain and spinal cord. Meanwhile, tetanus is a disease caused by bacteria found in soil, dust, and animal droppings, which enter the body through wounds and cuts. The bacteria produce toxins that affect the nervous system, causing muscle stiffness and spasm. Tetanus is not contagious and cannot be passed from person to person. Next slide. So now is the epidemiology. Rabies is a zoonotic disease that affects both humans and animals and is more common in rural areas. It is more commonly caused by dog bites and is found in many parts of the world, with the highest incidence in Africa and Asia. According to World Health Organization, about 59,000 people die from rabies each year. Meanwhile, tetanus is a rare disease that is more common in developing countries with low vaccination coverage and inadequate wound care. According to World Health Organization, also there are an estimate of 30,000 to 60,000 cases of tetanus each year, with the highest incidence is in Asia and Africa also. And the vaccination has made tetanus rare in developed countries. Okay, that's all from me. Thank you.
First of all, my name is Devaline Ramadhan with three last number 016. The pathophysiology of rabies involves complex interaction between the virus and the host immune response, resulting in a cascade of events that ultimately lead to fatal outcomes. The rabies virus enters the host body through the saliva of an infected animal during a bite or scratch. The virus attacks to specific receptor on the surface of muscle near the bite site and enters the cells. Once inside, the virus replicates and spreads locally, reaching nerve endings and invading peripheral nerves through retrograde axonal transport. The virus then travels along the nerves toward the central nervous system, primarily targeting neurons in the spinal cord and brainstem. The rabies virus has a high affinity for neurons and exhibits neurotropic properties. It can infect a wide range of neurons, including sensory, motor, and autonomic neurons, as well as neurons in the limbic system and cerebral cortex. The virus uses the host cellular machinery to replicate and produce viral proteins, leading to neuronal dysfunction and cell death. The virus also induces an inflammatory response in the central nervous system, characterized by the inflammation of immune cells and the release of pro-inflammatory cytokines, which contribute to the pathophysiology of rabies.
Hello everyone, my name is Widhandti Putra and last digit of my student ID number is 022. Right now, I would like to continue our discussions about the diagnosis of rabies and tetanus. Let's start from the diagnosis of rabies first. So in order to diagnose rabies, there are generally three methods as shown in this page. The first one is the diagnosis of rabies based on clinical presentations. The spectrum of the clinical signs of the rabies itself is divided into three periods: the incubation period, prodromal period, and acute neurological phase. Among these three periods, the most typical one is the acute neurological phase. Based on the clinical manifestation in this stage, the rabies can be further divided into two categories: the encephalitic and paralytic. The encephalitic rabies occur in about 80% of rabies cases and is characterized with the intermittent agitation, severe salivations, and hydrophobia. In contrast, the paralytic form shows muscle weakness and eventually paralysis as clinical manifestations. Next, we have antemortem diagnostic tests. So the sample used for this test includes a set of four biological substances obtained from the patients before death, which includes skin biopsy from Nicole and Beck, saliva, serum, and also cerebrospinal fluid. More detailed information about the types of antemortem rabies testing mentioned before are summarized in this table. Besides antemortem testing, the diagnosis can also be done after the patient death, or we call it as postmortem rabies testing. Uh, and some of these testing methods are summarized in this table. Next, we move our discussions into the diagnosis of tetanus. So the diagnosis of tetanus is entirely based on the history taking and clinical finding. History taking can begin with examination of the presence of stab wound resulting from dog bite. We can also assess the history of DT or TT vaccinations, and last we can examine the time span between the occurrence of the first clinical symptoms and the occurrence of first seizures. Clinicians can also use the spatula test to define the rectal spasm of the jaw. The laboratory finding in this case is usually not typical, so it's not as much give us help. Uh, and it's important to note that other etiology of spasm must be excluded before the establish of the tetanus diagnosis. So that's all from me, and thank you very much. Next slide.
My name is Arin with the last digit number of student ID is 002. I will explain about the complication of dog bites. Dog bites can occur at any age, but these incidents are particularly common in prepubescent children, leading to a higher rate of injuries in this group can have consequences. Dog bites could lead to a local wound infection, tetanus, or rabies that could come from either the saliva of biter, skin flora of victim, or the environment. Rabies infection that is not handled properly can cause various fatal complications such as hyperventilation, hypoxemia, respiratory depression with apnea, atelectasis, and aspiration pneumonia. Meanwhile, the complications that can occur in tetanus are airway blockage, seizures, rhabdomyolysis, acute renal failure, nosocomial infection, sepsis, HAP, decubitus ulcers, embolism, hypotension, and bradycardia. That's all from me. Thank you. Next slide, please.
Okay, thanks for the opportunity. In this section, we will talk about the treatment and the management of dog bites wound. Before we start, let me introduce myself. My name is IG Marvadi Pasta with my three last ID numbers 0 to H. Now let's start. First thing first, we will talk about the management of rabies suspected patient from the dog bites. There are 3 steps you need to follow. First one, wound management. You can clean the wound on the site of the injury by using natural soap and running water. Second, antiseptic cleaning by using alcohol in order to kill any remaining virus in the site of the injury. The last one is the vaccine for the patient. Anti-rabies vaccine include post-exposure prophylaxis, and an anti-rabies serum include human rabies immunoglobulin. ARV and ARS can be given to the patient according to certain terms and conditions. From the flowchart, we know that vaccine is not always needed after the dog bites injury. We need to know the right time and condition to give it. And also, the wound from the dog bites can be classified into 3 categories. First one is when someone licked by the dog or touching and feeding the dogs. Second, include minor scratch and abrasion without bleeding. The third category is include single and multiple transdermal bite and contamination of mucous membrane with the dog's saliva. These categories can help the doctor to provide the right treatment for the patient. If we suspected the patient have tetanus infection, we can follow these treatment methods. Start from removing the source of tetanus plasmin by using antibiotic like metronidazole, penicillin, tetracycline. After that, we can neutralizing the unbound toxin from the site of injury by using human tetanus immunoglobulin (STIG) that injected in 3 different sites of the patient body. The last one is if the patient condition become worsened, ICU quarantine observation with sedative medication is needed to prevent the muscle spasm in respiratory area that can lead into death. That's all from me. Thank you. Next slide.
Okay, thank you for the opportunities. First of all, let me introduce myself. My name is Putu Harum Rahcetag. The 3 last digit of student ID is 018. So now I'll present about the prevention of dog bites in children. The prevention of dog bites in children can be done based on the factors that are involved in this incident. There are the child, the dog, and parental supervision. In terms of child, they must be educated regarding the dangers of dog bites and how to behave properly when around dogs, like approach the dog slowly and calmly, then don't disturb dog while they are eating, sleeping, or breastfeeding. Then the dog also must be treated well by caring for them properly and vaccinating them regularly. Then for parents, as people who always with their children, should always supervise their children, especially when the child interacts with a dog. That's all from me. Next slide.
Hello, back again with me. Now I'm going to talk about the conclusion. Dog bites are the lower or upper teeth making physical contact with the victim's skin with adequate pressure to cause a visual injury such as indentation, scrape, puncture, bruise, welt, or rip in the skin. Dog bites can be a significant source of morbidity for children, given that they may leave scarring or other disabilities at a young age, including acute emotional distress. In rare situations, dog bites can result in tetanus, a bacterial infection that causes painful muscle contractions and, in some cases, difficulty breathing, as well as rabies. This viral infection can cause confusion and agitation and is almost always fatal if not treated. Reflecting on on the many cases of dog bites in children, we must be more vigilant and alert in dealing with conditions when they occur. Next slide. Thank you for watching. We are sorry if we have said something wrong, and I'm going to close this with Parama Santi, Om Santi 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 Om. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, and best wishes to all of us. Thank you.